living with anxiety and depression and other challenges to battle on a good day, but during this time of virus and sheltering in place, it can really present greater challenges. Jonathan Eric Carroll is the founder and CEO of the clinic at the Montgomery in Owensboro, and he's here to talk about the issues people face while they're sheltering in place. Good morning.
Good morning. Thank you for having me.
Thank you so much for being with us. You know, the questions race through people's minds of how are family members doing, how are colleagues doing when they know they struggle with anxiety and depression during regular seasons. So what advice can you give, or what are you seeing from your clients?
Thank you for the question. It's a topic that I think is getting some attention, but probably not what it needs to. I think if people haven't experienced depression or anxiety in what we have referred to as normal living, then we have no way of understanding how to think about it. And certainly we don't in a time that is as stressful and anxiety-inducing as this one. So it's so important that we have the conversation. Of course, there are plenty of people out there who are open and willing to give helpful tips. Of course, it's really important that people develop and maintain strong morning and evening routines, especially. That we account for our time in chunks, because people have said that it is so easy for the morning to become the evening, and we change from our morning pajamas to our evening pajamas.
Right, we hear that a lot,
we
yes.
Create our time in chunks, and we manage that time with routines. Of course, on a day like today, the sky is blue, the sun is out, it's beautiful. People really do need to get outside, remembering, of course, that physical distancing, which is so important. Also, I want to encourage people to search for what is positive. We get caught in a negative feedback loop, and it's so easy to think negatively, which our brains will then create short little bridges or shortcuts to make it easier to be negative the next time. Well, the same thing happens with positive thinking. A specific and concrete way to be positive is to scan our lives for what we are grateful, to write down 10 things every day in a book, in a notebook, and then to do it again tomorrow and the day after that, never repeating anything for which we're grateful. We'll be amazed at how quickly we move from family and friends and loved ones and a home to the sound of water pouring into our coffee cup in the morning, or the sound of a bird on a wire outside, or the sound of rain hitting a puddle. When we're scanning our lives for what is beautiful, we can be grateful, and that literally changes how our brains work, making us more positive and making us, of course, more open to beauty and wonder, even in a very dire and anxious time.
Those are good practices for all of us. And as we look, Jonathan, down the road, because we don't know when this is going to end, and there's just ramped up anxiety for all of us. Is it going to be May? Is it going to be July? And all those questions that are rolling about the what ifs. Help all of us kind of manage this, the big question marks.
This is a time, because we've been in this as long as we have, that people are becoming bored, and they're becoming antsy, and we are frustrated.
Yes.
And so I think people are really pushing for a loosening of restrictions. And I've heard it said that loosening restrictions because we're flattening the curve is like cutting off the parachute because it slowed us down.
Yes, I read that.
It's not smart for us to do that until our public health officials have told us we have the green light to begin phasing in a new way. So while we are anxious and bored and antsy and frustrated, we need to attend to that. One way is to ask ourselves, when have we felt like this before? How did we manage it? What were the conditions then? What were the circumstances then? And to say those very important words, look at me now. We got through that time, whenever that was. We will get through this one too. Unfortunately, of course, we're watching these numbers increase, and we know that not everyone is getting through this. And that's what's really ramping up our anxiety, especially for people who are living with others who may be at risk. Children, people with pre-existing conditions, those who are in a particular age population who are maybe more vulnerable. It's really difficult for us, I think, who are caring for people to have that positive outlook. That's why it's so important, I think, that we stay present in this moment. We are not going to live a life of 10, 20, 40 years of physical distancing stuck in our homes. We know that this will pass. We know that we are co-authors and co-creators of how that time passes. So the more strict and stringent we are now, the better it is in the future. So I think taking a more proactive approach, recognizing that our efforts and sacrifices now are compassionate and loving acts of service to ourselves, our families, and our neighbors means we are a part of this. This isn't something that's happening to us. We are participating in something that's happening around all of us, which gives us a sense of ownership and responsibility, meaning we take more control. We feel a little bit of control in an otherwise seemingly powerless and helpless situation.
Jonathan, I just treasure every word that you've given us. Thank you for your time. Thank you for your expertise. Stay safe.
Thank you so much. Good day to you. Stay safe.
We'll be back with more Local Lifestyles right after this.